but don't worry, you won't be you won't be in the recording unless you are speaking. But yeah, we've already spoken to you guys. So if you need anything during the event, Beth Foster Ogg and Jack Barton are available to you. So feel free to kind of message them in the chat if there's anything you guys need. So I'll do a quick introduction to the campaign and then I'm going to hand over to our speakers. So no one wants to get sick, but when we do, we want to know that we can get better and take the time off that we need, as well as be able to still afford to pay the bills. But in this country, there are 2 million people that don't receive any sick pay at all because they're not eligible. There is also a third of workers in the UK that only receive statutory sick pay. Now, statutory sick pay is the legal minimum that an employer has to pay someone when they are sick. Statutory sick pay is paid at such a low rate that it means that people cannot take the time off they need. It means that people cannot make ends meet and meet the cost of living, especially at the moment. Statutory sick pay also means that you have to lose 3 days pay before you see any sick pay, which obviously means that people can't afford to live. This system means that people either have to work sick, so having to go into work when they really shouldn't be, which is detrimental for their health, but also is dangerous for other people's health in their workplace or elsewhere. Or they have to make the decision to stay at home and worry about how they're going to pay the bills. Now, no one should have to face that choice. And it is important that, it's a time that we change this outdated system that isn't working for us. So what we're calling for is for a change in statutory sick pay so that everybody gets sick pay from the first day that they are off sick and paid at the living wage rate, or if someone earns less than the living wage, at the same rate as their wage. This safe sick pay would ensure that people can look after their health, they can keep others safe from infection, and people can ensure they can make ends meet. So without further ado, I'm going to hand over to Adela now to give us some more background to this campaign.
All right, thanks, Amanda. Hello, everybody. My name is Adela Beletsova, and I work as an English teacher for an organization called English for Action. And we teach English to adult migrants, and many of our students work as cleaners. And that's why I joined this alliance, Cleaners United. So Cleaners United is an alliance made up of community organizations, migrant organizations, and trade unions. And I'd like to recognize the groups that are working together. So I'm going to read out the names. So if you're here, give us a wave, please. So it's IRMO, Organize, English for Action, LORS, RMT, Unite, PCS, IWGB, Worker Rights Center, POMOTS, Eastern European Resource Center, and Shiva Foundation. If I've missed anybody, please let me know in the chat. And so together, we use methods, community and worker organizing methods to bring about positive change to our community. So we're building relationships and we're building power to be able to bring about this change. And so at the start of this organizing process, we always listen to our people. So we ran a listening campaign during which we listened to 350 cleaners by holding one-to-one conversations, group conversations, and some surveys also. And during this listening campaign, we heard a lot of terrible stories, people being exploited, people working in really bad working conditions. But some of the things we heard over and over again. And so there were 5 key issues, which were low pay, lack of sick pay, bullying and harassment, overwork, and then also short shifts at unsociable hours. So to analyze these problems further and also to see what the priority was for our alliance, we held an issues workshop. And we had a conversation and we were thinking about like, what is the top priority, which was the sick pay. And so that's why we're here today launching this campaign for safe sick pay. And just to give you a bit of a context on this, so only 21% of those 350 cleaners told us that they're allowed to take sick leave, which means that 79% of those people are not allowed, which, yeah, I think is really terrible. And so we will be publishing a report today. The link is in the chat. So if you're interested to learn a bit more about this, there are the results of the listening campaign and our recommendations for what to do in terms of sick pay. And now I will hand over to Sophia, and she'll tell us a bit more about the problems that cleaners experience in relation to sick pay. Thank you.
Thank you, Adela. Hello to everyone. My name is Sofia Torres. I'm a member of Cleaners United and a member of the board of the Center for Progressive Change. I was cleaner for years until recently, and I don't want to other people to have to live through the experiences I lived through. That is why I'm involved in this campaign, to help others be able to get their work rights in the UK, including getting decent sick pay. There are 4 key issues with sick pay. The biggest issue with sick pay is that statutory sick pay is too low. You cannot live on it. £99 a week is not enough to pay the rent and be able to cover food costs for your family. Secondly, you also have to lose 3 days pay before you receive any statutory sick pay. This means you cannot survive these 3 days, pay for food or anything. If you are not being paid for years, when I was sick, I had to go into work ill because I couldn't afford to take the time off. This meant my health will get worse rather than being able to take the time off to recover. Thirdly, if people earn less than £123 a week, then they don't qualify for any sick pay. Many cleaners work many jobs on minimum wage, so they don't get sick pay. How do the government think you can survive if you don't get paid for this time off? Especially now during the cost of living crisis. Lastly, statutory sick pay is a right, but many companies don't respect that. And there doesn't seem to be anyone enforcing this. I had a cleaning company say to me that they wouldn't pay me my sick pay. What could I do without paying for a lawyer? I have no one to turn to. One of the big impacts on this system is family life. If one parent gets sick, and isn't able to carry on working, how are they supposed to provide for their family? You feel so stressed and powerless. This also greatly impacts people's personal health. If we can't take the time to get better, this greatly affects our health and we can get even more ill. We have a right to look after ourselves so that we can help other people and our families. We are humans. We left our countries, our home, which was not as easy, looking for a better future. Once here, it's unfair feeling that our rights and needs are ignored by our employers. It makes us feel like cleaning is a dishonorable job. In my way of saying things, cleaning is a profession like any other, and our rights must be respected. We must be free to ask and have answers from our employers without being told we are problematic or complicated. as my last cleaning manager called me when I asked for my SSP. For these reasons and more, it's time that we change the sick pay system. Thank you.
Thank you, Sophia. Thank you for sharing your story and also, the experiences of other cleaners as well in the UK. So just like Sophia and many other cleaners, I'm sure that there are many people in the room with a story of sick pay. Now, this might be a story of a time when you didn't receive sick pay and you didn't get the support that you needed, or it may be a positive story of a time when you got sick and your employer pays occupational sick pay and you were able to take the time off that you needed. So what we'd like to do now is to get people to share their story into the chat if you feel comfortable to, or Beth is going to put a link into the chat if you don't want to share your story publicly, just so that we get an idea of what stories there are in the room of a time when either you didn't get sick pay or you are grateful for the kind of sick pay that you're able to get, and obviously that everyone should get. So to give you a kind of short example of a story of sick pay. So in May this year, I had a worsening cough and it had been going on for about a month. I went for a walk with my partner, and by the time I got home, I had such intense chest pain that I had to call 111. When I got to the hospital, they did a series of tests and they eventually told me that I have pulmonary tuberculosis. Now, when I found that out, I was obviously very shocked and extremely worried because I thought this was a disease from the Middle Ages. But yeah, tuberculosis is still around and it is still a deadly disease that can attack your lungs. So the first thing that the doctor told me to do was to self-isolate for 2 weeks to make sure that I wasn't going to pass on the tuberculosis to anyone else. And they asked me to start on a 9-month treatment plan, which I'm still on now. And finally, the doctor said, you really need to rest up because you need to rebuild your lung capacity from the damage that the tuberculosis has done. So obviously we're a good employer, so we pay occupational sick pay, and I was able to take the time off that I needed. Firstly, to self-isolate and then to recover my lung capacity. And I'm extremely grateful for that because I have no idea how I would have been able to pay bills, to pay rent, or to pay anything else if it hadn't been for occupational sick pay. And I think it's an absolute disgrace that some people get it and others don't, when everyone should have the same right to be able to take the time off they need. So as I said, please share your story in the chat if you feel comfortable to, or in the link that Beth is going to be sharing, and we'll come back to a few of these stories later on in the event. So when cleaners decided through the listening campaign that they wanted to focus on sick pay, the first thing we did was to look at who else is impacted by this. And we saw that there are some incredible campaigns already active in this area. Sick pay doesn't just affect cleaners, it affects all sorts of workers, it affects employers, it affects people with mental health issues, it affects people with physical health issues, affects public health, affects the economy. So we started to look at, okay, who else is impacted by this and how can we bring them together in coalition? So I now want to hand over to 3 speakers who are going to look at sick pay from the angle of workers' rights, mental health and physical health. So we first have Frances O'Grady, the General Secretary of the TUC. Unfortunately, Frances couldn't be here today, but she sent us a video message with Beth, which Beth will play now.
Great to see cleaners fighting for better sick pay, a campaign that benefits everyone. We saw in the pandemic how our system of sick pay let us down time and time again. People were left with terrible choices between risking infecting workmates by going into work or risking their family's financial well-being by going without. That wasn't right then, and it's not right now. Workers in other countries get far better sick pay than in the UK. The UK has one of the lowest levels in Europe. Working people deserve better. But so far, the government's response has been hopeless. Last summer, they had the cheek to tell us that now is not the right time to introduce changes to the sick pay system. But we know that there's never been a better time for workers to get what workers have well and truly earned. The TUC will be supporting this campaign every step of the way, so no worker should have to fear that falling sick means falling into poverty. And so every worker, whatever our race, religion, or background, is treated with dignity and respect.
Thanks for that, Beth. So yeah, it's incredible to have the TUC as a supporter of this campaign and to be working together on this. So the TUC were obviously at the kind of vanguard of ensuring that people had the sick pay that was needed during the pandemic, ensuring that people got sick pay from day one if they had to self-isolate, and that there were extra payments in order to make sure that people could make ends meet during the pandemic. So yeah, it's brilliant to be joining forces on this campaign. So I'm now going to hand over to Zoe, who's a Senior Policy and Campaigns Officer at Mind, to talk about sick pay with regards to people with mental health issues.
Oh, thanks for that. I think I had some slides to put up. Let me just get those going. Perfect. Thank you so much. Yeah, so hi everyone, I'm Zoe, I work at Mind, and I just wanted to take the next 5 minutes to talk to you about fair and flexible statutory sick pay for people with mental health problems. But before, I just wanted to say a really big thank you to the organizers for making this event happen, but also for including mental health perspectives and conversations about statutory sick pay. Those of us with a mental health problem should be able to feel safe and secure in work, and that must include when we take time off sick. And just to echo what Francis O'Grady was saying, if now isn't the time to reform sick pay, then frankly, I don't know when is. So we know that statutory sick pay isn't working for people with mental health problems at the moment. So could you just do the next bit of the slide, please, Beth? That's great. Thank you so much. So Mind did some research with people with mental health problems a few years ago now. We wanted to ask people directly about their experiences of statutory sick pay. One of the main things that came out of that research was, we found out that 2 in 3 people that were receiving statutory sick pay said that it caused them financial problems. And for some, this meant going into debt. More than 1 in 4 specifically mentioned that it had affected their ability to pay their bills or to buy food. So it's really clear from this that sick pay isn't giving people what they need to live on. It's plunging people into hardship, and it's leaving many people struggling to pay bills or to buy food. Now, what worries me about this is research that we did in 2019, and we know that the socioeconomic impacts of the pandemic and the cost of living crisis will mean that a lot of these issues will be worse now. So particularly when we think about things like, we know that people have been going without essentials as a result of rising cost of living. We know that people are struggling to pay their bills and are struggling with debt, and that this is impacting on their mental health. So yeah, I think it just bears reminding. Some other things that came out of the research we did. So 3 in 5 people told us that the reduction in income caused by a statutory sick pay had a negative effect on their mental health. And then 1 in 4 also stated that this slowed down their recovery. So I think for me, this really illustrates the impact that statutory sick pay and issues within it can have on mental health. We know that when people experience financial hardship, it causes a cycle, particularly with sick pay, where people either feel they have to return to work before feeling mentally well enough, or they're not taking time off at all despite being unwell. And it's a key reason really why 300,000 people with long-term mental health problems are falling out of work every year. And it's also a really key driver as to why there's a 37% disability employment gap, facing people with mental health problems, which we know is even worse for people that experience severe mental health, particularly around psychosis. So just not to be too bleak, talk about some of the solutions. If you could put the next slide up, Beth, that'd be great. So what does fair and flexible sick pay look like? So I think I just want to be really clear that a more generous system is possible. And we believe that more people would be able to return to work after taking the time that they need with the right kind of reforms. One of the kind of main things for Mind is around having a flexible model for sick pay. So we want to see a sick pay system that's flexible enough to allow people to do voluntary phased returns to work where they can receive wages and SSP on a pro rata basis. If we think about just what it feels like to return to work after a period of sickness absence, it can be really daunting, but we know in particular for people with mental health problems, the prospect of returning to work on full hours after sickness absence can be really difficult. And we want a sick pay system which enables people to take on lesser hours, for example, and do phased returns when they go back to work to kind of ease back into things. And just the sick pay model at the moment just doesn't allow for that. So we really want to see flexible sick pay paid pro rata. This is something that our CEO, Paul Farmer, recommended in the Thriving at Work review back in 2017. This is a review that Theresa May, who was Prime Minister at the time, commissioned into workplace mental health. And it's a recommendation that government's taken on board but has yet to implement in the last 5 years. So it's something that we're really keen on and we keep pushing on because we think it's a really straightforward reform that would make a really big impact on people's lives in terms of their mental health in the workplace. Some of the other things we'd like to see happen with sick pay we're not alone in calling for these. A lot of other people support these kinds of reforms. The main one is just around like inadequacy of sick pay rates. So we think it's really important that sick pay is increased in line with the real living wage. And that's just because sick pay really shouldn't be pushing people into hardship. Not only does it worsen mental health problems when people experience financial hardship, it can also trigger mental health problems and create a kind of vicious cycle in work around mental health. We also think it's really important that sick pay is available to everyone, particularly to people on low incomes who are currently not eligible. So one way to do that would be to remove the lower earnings limit. Again, this is something that the Taylor Review kind of recommended back in 2017, and we've not seen any movement on that, which is really disappointing, to understate things. It's particularly important as well for people with mental health problems because we're more likely to be in low paid and insecure work and therefore be ineligible for things like statutory sick pay. So there's just another reform I guess I wanted to talk about quickly, which is about making sick pay payable from the first day of sickness. Firstly, just the fact that the government did this during the pandemic shows that the will is there and it can be done. But it's really important for mental health because it's really common for people to take maybe 1 or 2 working days off sick just to deal with their mental health. And it's really unacceptable that that's not covered in the sick pay system. And I think really goes to show how the sick pay system is really designed with physical health in mind rather than mental health a lot of the time. And the other thing as well, I guess, with that is the worry that it causes people to not have sick pay paid during those first days can really worsen and contribute to mental health problems and anxiety. And then just the last reform we'd like to see happen as well is about extending how long people can claim sick pay for. So we'd like to see this move from 28 to 52 weeks. And that's really because a lot of people will be pushed out of work once they reach that 28-week cutoff point. And we think extending that would be a really good way to help people with mental health problems stay in work longer. So that's just that's the quick overview from Mind, I guess, of some of the key issues and solutions. I've just got my contact details on the next slide. So if anyone wants to get in touch or give me an email, you're more than welcome to do so. Thanks.
Brilliant, thanks, Zoe. And yeah, we definitely support all of those legislative changes, as I'm sure so many other people in the room do. And it kind of seems like, it is the kind of common sense approach to sick pay that so many people agree with. And again, I just want to highlight the amazing work the Mind have been doing on sick pay already and getting mental health charities, disability charities and so on together to campaign on this important issue as well. Great, so I'd now like to hand over to Jack from Young Lives vs Cancer.
Hi everyone, nice to meet you all. I'm Jack, I'm a speaker and volunteer from Young Lives vs Cancer. Back in May 2021, I was diagnosed with stage 3 advanced melanoma, which is a type of skin and lymph node cancer. At the age of 21, being newly diagnosed and thrown into this new life, consumed by cancer, was such an awful time for me. Prior to my diagnosis, I lived a happy, healthy, typical life of a young adult. I enjoyed working, going out with friends, attending festivals, just doing everything a young adult enjoys doing with their time. Having lost that life I lived previously was such a hard hit on my mental health. Working whilst battling cancer for me was the first big hurdle I knew I had to overcome. Back then, spending 99% of my time in and out of hospital, I figured there had to be a way I could work around this. There was no possible way I could walk away from work. Having worked in my job for over 7 years, working my way up to management, I found comfort in my job and knew I could come to an agreement with my manager to figure out how I'd still be able to work whilst facing cancer. I requested a meeting with my then manager to talk over the time I would need off. My manager, a big character, but always soft on the inside, a side I had always seen to him until now. I walked into the room with a positive mindset, thinking that we could reach an agreement about the time I needed off sick. But by the time I'd sat in the room, I could tell the mood in the room was just dull. I had a list of things to propose about what I could do before and after my treatment. First, I said the hospital had asked me to self-isolate 2 weeks before my 2 major surgeries. Obviously, this was important as I couldn't catch COVID before going into hospital. To that, he had a cold reply and said that isn't something we can work with. We need you to be coming in. I was shocked that he just didn't seem to care at all. I then said I will need time off after surgery to recover, to which he bluntly said you can take 2 weeks unpaid. At that, I felt immediate discomfort. There was no way I could live unpaid for 2 weeks. I thought if you were sick, you'd get sick pay so you can do what you've got to do to get better. In this situation, I just felt stupid. I knew I was within my rights, but in this situation, I questioned whether I was the one in the wrong. I tried to fight my corner, but he just said I was unable to run a business with a colleague like myself. After a meeting, I spoke with a counsellor, I handed a sick paper in, I spoke to HR, but nothing would change their mind. I'd signed a new contract to this previously, and they used this against me as a way to not pay my statutory sick pay. Having given 7 years of service or work to this place, I just felt completely let down and undermined, all because of my health issue that was totally out of my control. After a long battle with the company to try and get sick pay or any pay at all, I decided to hand my notice in. Having found myself in this situation and the same in following workplaces, I took to social media to spread awareness for young adults facing cancer to try and help them guide through these tough times. To my surprise, my social media took off and hit the press pretty quick. Completely new to all this media attention, I jumped head first in and knew if I could help at least one person, that would be my job complete. Just over a year later, I now work closely with the media to spread awareness and bring light to situations such as my story. I've built an incredible following of people who I can count on for anything and created a community where all is welcome. Using my story to help and guide others through such a difficult time, I'd never want anyone else to experience the hardship I faced in a workplace while facing such a devastating illness. I'm so grateful I get to use my voice and platform to strive for better in and out of workplace environments. I believe we all, as equals, deserve the right to not face financial worries whilst battling illness. That's why I'm excited about this campaign. We need to make sure workplaces are looking after their staff properly and providing safe sick pay.
Thank you, Jack. Thank you so much for sharing your story. Yeah, absolutely no one should be in that position where they've just had a terrible diagnosis, and the last thing you should be worrying about in that moment is whether or not you're going to be able to make ends meet and pay your bills. But yeah, thank you so much for sharing that with us. So now that we've talked about the kind of issue with sick pay from a range of kind of different angles, and hopefully we're all in agreement there is a kind of serious issue here. I just want to reiterate, the things that we're calling for in terms of kind of a solution. So we're calling for the government, but also for employers, to make sure that all of their staff are paid sick pay, no matter how many hours they work, no matter how much they get paid, no matter how long they've been with the company, ensuring that absolutely everyone is covered under a sick pay scheme. Ensuring that that's sick pay is from the first day that someone is off sick. As Zoe was saying, sometimes you just need like a couple of days off in order to get better. And it's much better that people, if you have a physical illness, for instance, don't come in sick if they're not feeling well and make everyone else ill. And thirdly, that sick pay is paid at the living wage rate. Or if someone is paid less than the living wage, at the same rate as their wage, so that people can afford to make ends meet, especially during the cost of living crisis. So to get there, we believe that there's kind of three main things we need to do. Firstly, we need to build power in communities. So if we want to see a change in statutory sick pay, we're going to have to influence and persuade a whole host of MPs to support these changes. So in order to do that, we need to see constituents getting together and starting to speak to their MP and make the case for a change in statutory sick pay. Secondly, we need to build power in our workplaces. So if people want to see occupational sick pay in their workplace, it is important that people are joining a union and bringing workers together so you can take collective action and pressure your employer to pay sick pay. And thirdly, we need public support on our side on this issue. There's many people that don't know the issues with sick pay because they receive occupational sick pay and they're covered from day one at the same rate of pay. So it's important that we're telling people the issues with sick pay and starting to gain national press attention on this issue. So I'm now just going to run through some of the things that we've done as the Centre for Progressive Change and some of the things that are kind of coming up. And then I'm going to hand over to Marion to talk about what people here could do. So firstly, in terms of the stuff that we've been doing already, so we've done a power structure analysis of the government and the kind of key figures in government to think about kind of points of leverage and where our campaigning might be most effective. We've obviously already started building this larger coalition of different organisations that care about sick pay, so we have enough power in order to make a difference. Thirdly, we've been creating a strategy using a kind of range of methods to ensure that we can achieve our aims. And today, as Adela was saying, we've launched a report making the case for sick pay, using the results of our listening campaign and what other people have written out there. And finally, we've started organising in key constituencies already, especially in the kind of Greater Manchester area, to make the case for sick pay to MPs there. So over the coming months, we're going to be building constituency teams and supporting those teams to meet with their MP and take local action to ensure that MPs are supporting this change. We want to see all of the major parties supporting this change ahead of the next general election. Secondly, we're going to be supporting trade unions in the incredible work they're already doing at organising workers around sick pay. So we want to make sure that those campaigns are highlighted and other people are supporting their efforts. Thirdly, we're going to be supporting people to share their story. So we want to make sure that people's stories are shared through social media and the press so people know what's happening. And lastly, in the next couple of weeks, we have a letter that we've written to the department, to the Minister of the Department of Work and Pensions, who is the Minister in charge of sick pay, asking for a meeting and saying that, it is time that this changed. So I'll now hand over to Marion to talk about what people here could do today.
Hello, everyone. My name is Marian Dimitrov. I'm a representative from RMT Union. I'm working in the underground, and we have the same issue with the sick pay. We just have statutory sick pay, and which is not really enough. We faced this during the pandemic. And we just got a temporary agreement for the self-isolations, and that was it, and not enough. We have many cases with the people that are long-term sick, and they are really struggling to come back to work, or even they're resigning. So what is important to do from today? Firstly, we need to join the union. We need to remember that the union can bring people together and fight for you. And particularly, we can organize and build up a collective power of workers and put a pressure to your employee. So in that way, you can achieve your goals. Secondly, it's really empowering to share your story or your colleague's story. It can be anonymously or not, it's up to you. You can do that by filling it the form in the chat, and we can keep in touch with you and advise you how to do it in your preferred way. And finally, to make this change happen, you need to speak to your MP first. We need to get the support from all MPs to make these changes happen. So you need to register. There is a form in the chat, so you can register and we can help you basically how you can reach your MP and facilitate any meeting with them and advise you how to approach your MP and to get their support. It's really important, and we will organize basically a local campaign, so to make sure they are on our side. Thank you.
Great, thanks, Marion. So that's right. So there's kind of 3 key actions that we're hoping, well, up to 3 kind of actions that we're hoping people will take. Firstly, yes, joining a union, super important if you want to ensure that you get occupational sick pay for yourself and other people in your workplace. Secondly, sharing your story. So yes, as Marion said, please use the link in the chat if you're happy to share your story. We won't use it without your permission, but we can get a feel for what kind of stories are out there, and we'll be offering training and support for people that want to share their story in social media and the press. And thirdly, speaking to your MP. So you can register to speak to your MP via the link in the chat. And then once we have a kind of mass of people that want to speak to a particular MP, we'll send a letter to the MP with the kind of different signatures, and we'll support people in preparing for that meeting and holding that meeting with your MP. If your organisation is interested in this campaign and has a kind of range of members that care about this, then you can also email us if you want to book a meeting and talk through what you'll be interested in doing. So our email address is info@centreforprogressivechange.org. Feel free to email us also if you have any questions as well. Okay, so that's the part of the event done in terms of kind of presentations. And we'd love to kind of hear from some of the people in the room. So we have about 10 minutes now to hear from people. And if people have any questions or any kind of comments, any stories that they want to share, or any ideas of what we can do collectively. I know that people have already started writing into the chat some ideas of different actions we could take. Then so now's the time that you can ask either myself or any of the speakers today. Okay, so we'll go with Marco. So you can either raise your hand or so much for sharing it. What I wanted to say actually is that this Safe Sick Pay campaign is the first campaign of a number of different campaigns that Cleaners United will be running. So we are still doing a massive research project that Josie here is leading on, and is looking at all of these different issues that cleaners are impacted by, and what are some other legislative changes and other things we could be asking employers to change to ensure that the working conditions of cleaners are vastly improved. So I'm conscious of time, so I'm just going to wrap up quickly. So just to reiterate, kind of coming from this meeting, we'd love it if people shared their story. So you can see the link in the chat, and also register to speak to their MP, because together, collectively taking action, this is how we're going to be able to make a change on this issue. Please join the mailing list to keep up to date with upcoming actions. So that should be in the chat as well. And that will be in English and in Spanish. So please make sure that you join that mailing list. And I just want to say, a massive thank you to the speakers today. Incredible to hear about the amazing work that is already going on and to hear people's stories. And thank you again, everybody, for coming. I really believe that together, taking collective action, we're going to be able to make a really big difference on this issue. So thank you all very much, and speak to you soon. Thanks, everyone. Thanks. Cheers. Thanks, everyone. Thanks, Kim. Ah. Yes, we are. Yeah, Adela. Great. Cool. Okay. Okay, great. So with the speakers, we're just going to have a quick evaluation. So I'm just going to kindly remove people. Here we go. And I'm assuming that's our Charlie, right? Charlie Y, so he can stay. Here we go.
Pause the recording, maybe.
Yeah, we can pause the recording too.